that's what life is about, is continually growing and heading in a more positive direction. And we need to get past what happened and head to where we're going. If they were back further on the path and hadn't gotten as far along as I had, I wanted them to be able to see over the top of the hill that the sun's coming up and there's hope on the other side, and they just need to keep climbing. My name is Don Robinson, and I'm a physician by training. I sought to get help from the United Brain Association and started to confer with them based upon my history of having head trauma and mild traumatic brain injury. The main part of my story begins with an innocent evening. I had taken my wife out to dinner and was meeting a friend. It happened to be raining cats and dogs, and we were on an island off the coast of Georgia called TBI Island. I'd gone to the restroom, which was outside this rustic building, and washed my hands and was trying to come back. Unfortunately, it was pouring rain, and being a runner in that day, I thought, well, I'll just run down this path back to the restaurant. Unfortunately, my feet slipped totally out from under me, and I whipped around and hit the back of my head and my back on this wooden walkway. Sometime later, not very long, I don't think, I realized that rain was falling in my face, and it was time to get up and try to get into the restaurant. So I did that, went into the restaurant, sat down, and tried to carry on, although I'm sure I was a mess, looking a little bit confused and wet and muddy from the path. The next day, my wife and I were out, and as I remember it, I couldn't remember her birthday, which was strange because we'd been married a long time at that point. Over the next couple of weeks, I noted driving down the road that things just didn't look right, that things along the side of the road that you shouldn't really be bothered by or even notice seemed to come out of the woodwork and bother me. I would see mailboxes, and as I passed them in the periphery of my vision, it'd be like it looked like a child standing by the road. And soon after the incident, my wife realized that I wasn't functioning in the same way. And I was honest with her about what I was experiencing. Going to the neurologist was an enlightening experience, but because the neurologist didn't have answers about how much or how long or when would I be back to myself, it left lots of questions and insecurities, really. Three weeks after the fall, I went to an orthopedist doctor friend of mine because my back was bothering me so much. And he was looking in my eyes and he said, "There's something wrong with you." And he said, "Your back will be fine, but I've got to get you to a neurologist, somebody to help you with your head." When I went to the neurologist and told him my story, he did a complete neurological exam. One of the habits I developed early on was kind of walking close to the wall and maybe trailing my hand along the wall for a little bit of extra assurance and confidence. He said that I had post-concussion syndrome, which is just a name. Basically, it means that you hit your head and you aren't quite right yet. So, but at that point, neither the doctor nor the victim really have any clue as to how long these symptoms will last. And I really learned in some of my investigation that it can take 3 weeks to 3 months to really evidence of all the symptoms you're going to develop after a mild head injury. And it was mild, it wasn't a major head injury with loss of brain tissue or skull fracture, but it's amazing how what we call mild can have such profound effects upon you and how you function. I was a practicing physician doing obstetrics and gynecology. Certainly, it changed the way I functioned in terms of taking naps at lunchtime or whenever I could, putting my feet up and trying to rest my head. It meant that my assistant in the office knew I might need a little extra time between patient visits to kind of settle down and recover a little bit. It meant avoiding bending over to pick up things because that would bother my head. There were quite a few little adjustments like that were necessary to try to minimize the symptoms that they could provoke. Running was really something I loved. I ran 11 marathons, and I actually ran a half marathon sometime after I had the head trauma. But I just remember the more I ran, the more confused I seemed to get, and the more balance problems I developed. In fact, if I hadn't been running with a friend who looked after me, I wouldn't have made it through that half marathon. I found out pretty quick that running wasn't in my best interest. It seemed to, in my way of thinking, jog my brain and lead to more difficulties in recovery. The main treatment I received was medical, and I got some medicine initially on that is typically used for patients with Alzheimer's disease because I was having memory difficulties. Fortunately, that didn't last that long, and I had headaches, and I got medical treatment for that. Unfortunately, those didn't last too long, and I think the biggest problem there is that most areas lack any real effective treatment. There are centers around the country that specialize in brain injury, and they have programs that they send you to help you hopefully resolve your symptoms after mild traumatic brain injury. But those places are few and far between. So most of us get treated by our local doc or neurologist, and they treat us as my doctor did, just treating the symptoms. I was not really ever offered a treatment that would help to resolve the injury of the brain injury. And again, that's still something they're working on. Those are things that are being developed, and there are centers around the country that do that better. But for most of us who are not living in those places, the options for actual treatment after a brain injury are limited. I think a significant piece of advice for someone who's had a mild traumatic brain injury is to seek out support early on, and to be honest with somebody who you love and who cares about you. We may not want to broadcast to the world that we can't stand up straight, or we feel uncomfortable driving, or any of a number of other strange visual or symptoms that one can experience. But we need to tell somebody. I was very fortunate to stumble across the United Brain Association. I found Jay Mady, the boss man there, to be very understanding, very interested. The others that work with him are very supportive and responsive. I got in touch with them after I'd written my book about my mild traumatic brain injury and my journey. The book's called Dr. Undaunted, and and it is available, and I'm not trying to sell my book, but I think that it can offer a lot of reassurance to people who are going through the journey. For those who are reaching out for some stability and guidance, and really learning that others have walked that same path before. You're not alone. That's a secret to adjustment to a lot of different conditions, is to realize you're not alone, and traumatic brain injury is one of those. So in contacting UVA and Jay and Lacey and discussing what I'd been through, and they set me up for one of their stories, and I did my brain story, and we just had a very cordial and mutually supportive relationship, because they're great people, and their emphasis is on supporting those who have brain problems. They're not focused on this brain injury or that brain disease. They're focused on supporting those who have brain issues. And there's really a lot of commonality between those of us who have brain disorders, whatever the reason for the disorder. Who would have known that it would take about 15 years for me to really resolve most of my symptoms, and to be able to give up most of the medicine that I was put on to help me deal with the problems I experienced. Thinking the journey might be that long is something that I never considered. And I went through, just like I'm sure others go through, and the anger that something was taken away from me, that my function as I knew it had to be altered. And then the grief of really giving up that part of yourself. But out of that, once you can kind of resolve the anger, once you can kind of deal with the grief and develop more intimate relationships with those who support you, you really can grow into a new being that is functional on a whole different level. And I think part of healing is not trying to get back to what you were, but trying to be the new you and be the best you can be, as the Army would say.